Welcome to Brain Wellness, the podcast. I'm your host, Mandy NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. My guest today is Aly McGee. Aly maintains her license as an independent clinical social worker. Although she may not be able to do what she once did, she is learning to do other things with the same passion she had to build River Counseling, a thriving mental health clinic in Sandy, Minnesota, in spite of a motorcycle accident on August 8th, 2020. Life was one way 1 minute, and the next everything was different. What the enemy tried to stop from Aly from doing to help others, God offered opportunities for her to bring light into darkness, hope into hell, and courage to navigate her way out of chaos. A fellow TBI survivor, thank you for being here today, Aly.
Thanks for inviting me.
Mm-hmm. So I always like to ask the first question of just tell me a little bit about your story. How did you get here today? So we know the accident happened, but you're a social worker, all the things. Just share as much as you want to share here.
Sure. Let's see. So becoming a social worker wasn't my original plan. I did know that I wanted to help kids whose parents had been divorced. That was kind of my thing. I didn't know what that meant. And so I got a bachelor's degree in elementary education in 92. And when all the teachers at the time couldn't find a job in the state of Minnesota and were going off to Texas and Arizona, I was like, well, I don't want to teach that bad. So I went and saw my advisor and they asked me what I wanted to do. And I said, well, I want to help kids whose parents have been divorced. And he handed me a piece of paper that basically broke it down to becoming a psychologist, a PsyD, a psychiatrist, or a social worker. And I read the paragraphs for each one, and social work looked easier than going to med school. So I was like, I'll do social work. So I went off to the University of Minnesota Duluth campus and got a master's degree in social work and pressed on through that. Had a lot of other areas that we'll find out if we get into that part of my life in this interview or not. But had my first child 31 years ago up in Duluth, and drama, drama, drama. Let's get us to, let's bring you up to living in the Cambridge Isanti area in my first marriage, thinking that moving from the city to rural Minnesota would make my marriage better. Um, it didn't. Uh, Drama, drama, drama. Ended up in a relationship that I call my 10-year nightmare. Got out of that and was settling into my career. I had started river counseling, was doing really well with that. And this is where I'm going to kind of shift a little bit back into that drama. So I didn't know that this was an issue, but I've had head injuries before. And so when I look back on what I've accomplished now, it's like, oh my gosh, I was doing that with a head injury. Like, wow, that is amazing. Um, so so all these things that I've done, um, I'm sort of filtering it through like what I'm going through now, and this is the first time I've talked about it from that perspective. Let's see, the accident was in 2020. 2014 is when the 10-year nightmare ended. And I was sort of like, I am going to just focus on my career. I am going to go full into being I'm a mental health therapist, so I was just super excited to be doing that work. And in 2014, I met a man who was my neighbor who, thought I was cool or whatever. In 2015, he proposed to me. In 2016, we got married. In 2017, We built a house together. In 2018, he stopped working. In 2019, I reflectively looked back on my life and said, what? I'm like in another not so good relationship. And in 2020 was our accident, and we were on motorcycle together, and it was awful. It was just, it was just. I mean, I'll give the details if you think your listeners want to know. But I fractured my neck. I feel my C2 was fractured. Uh, I was only in the hospital for 3 days, and no one mentioned the word head injury,
Mhm.
concussion, head injury. Those issues were not even brought up. So here I am in this neck brace, you know, back home. And like I look back on it now, and I remember like I'd be sitting at a table and somebody would bring me a plate of food, and I could see the fork that I didn't know was a fork. Could see the plate of food, and all that it was sort of like, okay, I know I know I need to use that to pick up that, but I'm not exactly sure how that looks. And like that's a surreal experience to realize like that's how bad I was, but no one around me knew because I didn't have the language to describe what I was struggling with. And so I think what happened to the people around me were when her neck brace comes off, she's going to be better. Like, because they could see that. They could see that that I had this thing and it interrupted me or in my life. But I like, had a hard time walking through doorways. And that's still an issue today. Visually, sort of where I am in space is kind of a big deal. And, um, and so 4.5 years ago, I still own this clinic, but I stopped treating patients. I, I, I run it to the degree that people can like ask me questions. And if I learned something or knew something before the accident, it's like right there. Like eyes closed in my sleep, wake me up about something about the clinic that I knew before the accident, and I'm your go-to girl. But for things to learn post accident, my ability to comprehend, to learn new things, to stay up to speed on like the changes in insurance, the changes in, like how a new system would work at our clinic, like not my jam.
Mhm.
So I've hired people to do what I used to do. And when you're trying to like get help, like Social Security, um, medical assistance, like me owning that clinic it's like a curse. It's like, I don't want it to be. It's my baby. I brought it up from nothing, and I want to continue to work there, but I've got to look at my future. I might end up in a home. I got to figure out how to make sure I've got, financial security because the marriage did not go well. He was not able to help me or support me. He took my emotional distress and how I wasn't doing well. He took it personally and couldn't see that like I needed help. He just saw, oh, so I can't help you. Oh, so I'm the bad husband. It's like I can't even have these kinds of conversations anymore. I could, before the accident, but
You're good. What are some of the toughest things you've had uh to battle during your recovery?
it's so lonely. When you don't have support, when people don't get it, you know. I lost a lot of friends, a lot of family. Um, I think the loneliness has been tough. The combination of having the skill set and the awareness, like I was a trauma survivor. I'm not a trauma survivor from childhood. I became a trauma therapist and then I experienced an adult trauma. So I have this like narrative thing running in my head where I like can almost see it. Like I can see myself. I know when I'm having a panic attack or a trigger or a flashback and I mean not the bad
Mhm.
ones. It's like I'm checked out, like whatever. But to like reflectively go back and like, oh, that was a flashback. Oh, like I know what I need to do. Like I have this awareness And yet my ability to put it into play or explain it or to ask for help in the ways that I need help. I hope this doesn't come across as self-righteous because it's certainly not who I am as a person, but it's like there's times I'm working with providers where it's like, I know more than you do. Like, why am I here? What is it that I'm trying to accomplish? Because I already know that. Like, can we get on the same page? And so that's been hard.
Mhm.
Um, I think I really longed for the accident to be the thing that was going to help my husband and I get better. Like I was really hopeful. I have people that told me that I was when I was in the ditch, paramedics and all the chaos. A helicopter had to come to take my husband. And apparently I was saying three things. And one was, I have to get to my husband. I have to get to my husband. That was one that kind of circulated. The other one was, thy will be done, thy will be done. It was use this situation for good, oh Lord, because we had been fighting before the accident. So it's use this situation for good, oh Lord, please God, use this situation for good. And there were so many amazing good things that came out of that. Like our church rose up and like showed up and helped us for solid weeks, probably into months. I don't really remember. But like my husband was watching the hands and feet of God like come around us. And and yet his response months in was, you need to tell these people to stop coming to our home. And it because for whatever, his own shame, his own pride, his own whatever that was for him. And once you get to the point that you're like, okay, receiving help is not a shameful thing. Asking for help is not a shameful thing. But if you grew up that that's your mentality, getting help kind of shines a light where people don't want to have that light shown. And so I was sad about that because I had done so much work on my own healing journey to be so full of gratitude. I was so thankful for for people who cared that much. And I think I was just heartbroken that my husband couldn't see it that way. And so he wanted us to be back in a, controlled, manipulative environment where he could decide what was going to happen between him and I. And I was just ready to move beyond that.
Mhm.
So, yeah.
Mhm. What were some of the things that helped bring you hope? You mentioned the people from church helping, but what else was there? Were there treatments, different things along the way that helped give you hope?
Yeah, so I was introduced to a doctor in our area. His name is Dr. Rainier, Dr. Bud Rainier, and he's sort of the concussion expert in our area who works as, he kind of comes across as being like mm, what does he call himself? He's like the quarterback. And so he'll be the quarterback of the team, and like you go see him, and he will, make these referral um, ideas. So like anything related to my injury, he was like, "Yep, let's get you referred to that person." So he was the one who was instrumental in getting me set up with vision therapy. And vision therapy is like according to Dr. Rainier, he says that the research really points to concussions being like that's a major hurdle. If you haven't crossed the vision hurdle, you know, you've got a long way to go because vision is such a huge part of the concussion picture,
Mhm.
like what we struggle with. So I go to Bright Eyes in Otsego, which is a neuro-optometrist, and I did 33 weeks of vision therapy. I have glasses. I have three pairs of glasses. They all have prisms. They all have degrees of tint. They all have what's called ocular binasals, which is um, it's like Scotch tape, really, or uh, clear nail polish that they put along the sides here, and it helps to block out all the like I call it sort of like data overload. Like the other day, I had to go to a doctor's appointment, And I walk into the building and, so I've got my glasses that are locked and loaded. I've got my earplugs in and I walk in and it's like, I said this to myself. Oh, it's too much data. It's just too much data. I can't like you got to find out where the elevator is and like what floor to go to and so I must look like I need help because very kind people will approach me and say, "Can I help you find where you're going?" I'm like, "I have to go potty." Can you find me? Like, yes, help me get to a bathroom. And um and so I've found some really kind humans, but I think it's because I think I kind of come across as like a little girl, like a lost child. I don't mean to, but like it's really hard for me to be out in the world. And and yet I keep going, right? I just keep I'm not going to give up. I never gave up before. I'm not going to give up now. And there's hope around every corner. You just have to, I think willingness.
Mhm.
Willingness is huge. You have to be willing to know that there's goodness and hope out there. It shows up.
Yeah. Yeah. I think every time I tried a new therapy in my recovery, I found new hope because I would hit a plateau, find something new, try something new, and I would see improvements again. And there was that glimmer again. And one of my friends and I were TBI warriors together. We check in and do virtual coffee every once in a while. And we talk about those glimmers when you find those little things that kind of give you hints as to, yeah, that's what I used to be like. That little hint again. Every time you get that new step and you find something new that helps you get a little bit better.
Yeah. And each provider that you see will hear your story where you're at that day,
Mhm.
and then they always have some kind of an intervention or something that you could do. And they might also have ones you don't like, right?
Mhm.
And it becomes like, are you going to choose to focus on the interventions they gave you that you don't like, or are you going to pick one or two that you do like? And one of my occupational therapist made a recommendation that I get a pad of sticky notes. And anytime I had a victory, write the victory on the sticky note and then stick it on my wall or on a window frame or, whatever. And, like I painted my toenails for the first time, 2 years after my accident. Like I wrote that down. I'm going to put that on my sticky note. Like I painted my toenails. Um, I I was able to like let my dog in from outside. I don't know. I'm assuming people do this, but like when you're brushing your teeth, you like will walk around. Like I'll brush my teeth and I'll go like get my bed ready. Well, for like a year and a half, no, like brushing teeth equals standing still. So when one time I was brushing my teeth and I heard my dog outside, I actually walked to the door and let my dog in. And I was like, oh my gosh, it's going on a sticky. I I did it. I walked and brushed my teeth. And so I ended up with probably, I don't know, 50. I was able to sit in a rocking chair once and not feel like I was going to throw up, like that one on a sticky note. And one of them I just saw him the other day, and I walked my son down the aisle when he got married in 21. So that got on a sticky note. And when I moved out of my house, before I moved, I took a picture of all my sticky notes all over my windowsills and just stuck them all together. And literally just 2 days ago, I found them in a drawer and I pulled them out. And the one on top says, I walked my son down the aisle at his wedding. And like, wow, right? I don't know that I would have remembered that, but here I have this little stack of stickies that show things I've accomplished.
Mhm. And it's really important to honor those accomplishments because I think it's really easy for us to get stuck in the wallowing stage where we look at all the things that we can't do anymore. And those seem to stay highlighted in our brains. But to do those, make those little sticky notes or something simple like that, where you can just honor those good things that happen. I think we need that because that gives us hope too.
Yeah, absolutely.
hmm So you had mentioned that you went to the Amen Clinic, and I've heard so many things about this. I would love to hear your experience as a patient. What was that like?
Yeah. So Dr. Amen, for any of you who don't know, he has written just a gazillion books on concussion and brain and mind and all of that. And I first heard about him on Pink, which is a Facebook group for women and girls who have had concussions. And someone mentioned him. I ordered his book called Concussion Rescue, but quickly discovered I couldn't read. So I got it on Audible and listened to that. So that was all back in like 21, 22, and then I sort of forgot about it. And then in just in 25, a girlfriend of mine who has a head injury was asking, she had heard about him. And so I looked him up again. He did a TED Talk, Dr. Amen, I think it was like 11 years ago. And he did a TED Talk, and the timing of um, an event that I was hoping to go to, and Dr. Amen, uh, I I went on Google. This is just 4 weeks ago. Went on Google, and this other event that I wanted to go to were happening like simultaneously, and they were both happening in Atlanta, Georgia. And I was like, I guess I'm going to Atlanta, Georgia. So I called up my daughter and I said, hey, you want to go do this with me? Dr. Amen does not have a clinic here in Minnesota. The closest one in Minnesota is Chicago. I there's lots of his clinics all over the state, sorry, the nation. Um, and so I decided to go. It basically what I learned is that he does not do traditional MRIs or CTs. He uses what's called a SPECT, SPECT, no idea what it stands for, but SPECT imaging, and can do a scan of my brain and of our brains, of people's brains. And he's studied over like 270,000 brains. And before I share the rest of the story, I want to tell you the reason I got hooked. And as a clinical social worker, when I read a statement that Dr. Amen said, I've since tried to go back and find it, and I can't find it. So I might be making this up, but I'm happy to be corrected. He had a really ginormous number, like over 90% of mental illness or mental health conditions can be traced back to head injury. And as a clinical social worker, therapist, mental health therapist, that blew my mind. So let's just pretend I'm accurate that it was like 93%. Not, let's say 93% of all mental illness, and it might be higher, can be traced back to a head injury. Blew my mind. Because guess what we're not always asking on a diagnostic assessment? And even if we ask the question in a diagnostic assessment of a patient, hey, have you ever had a head injury? Even if 50% of them say, no, Dr. Amen says, ask again, ask again, ask again, because he will find that after he asks like 7 times, he might have a client say, oh, do you mean like when I fell out of a window when I was in second grade? Yeah, something like that, right? And so people forget. You forget what you've been through in your life, and you didn't make the connection that, oh, that time I hit my head could have been why I've struggled with depression, anxiety, all these things. So that's what hooked me, and that's what really got me. So the healing journey for me of taking that statement by Dr. Amen got me to remember that I had a very serious head injury when I was 18 years old. And when I look back on my life, impulsivity, started getting treated for depression, my poor choices in relationships, like, wow, could there have been a correlation? And I could say now with like 100% certainty, absolutely. Was I treated for a concussion? No. Did anybody know about concussion? This is in 1988. We weren't having that conversation. So kudos to you for creating a space for us to talk about this, not just as women. I think the conversation around women and concussion is important. So I digressed. Oh yeah, so I've been diagnosed with acquired ADHD.
Mhm.
Yeah, so that's what that just was. Um, like everybody in my life, pre-accident, my mom, my daughter, a lot of the contractors who work at my clinic all had ADHD, and they drove me nuts. I was like, no, focus. What's wrong with you people? Get back to work. And since my accident, I'm like, guess what? I so understand why you relate to, your life. And now I'm just, yeah. Anyway, okay.
Mhm.
So, fast forward. So in Atlanta, Georgia, went to the clinic. My daughter came with me. We actually both got our brain scanned. It was
Mhm.
pretty sweet. And so it was 3 days of testing and then follow up, with the doctor to kind of tell you what their thoughts are. And I will spend as much or as little time, but I'm just going to show you. This is one of the images that you get like as a result. That's my brain with the holes in it. And then there's this other, they're actually not holes. It's just it's where there's less blood flow.
Mhm.
That terrified me at first, but and then this just shows like where the blood is flowing when you're because they test you when you're concentrating and then they test you at rest. And so if I took all that and I summed it up into what my daughter told me that the doctor told me is wrong with me, because that was a lot of information.
Mhm.
The parts I remember are my thalamus is overworking, so there's too much blood going to my thalamus, and my cerebellum is not working hard enough. So there's not enough blood going to my cerebellum. And then they can see injury to my brain based on blood flow. And for me, that's why I went. I just wanted to see it. I wanted somebody to say, hey, this is why you're struggling. And then I'm still undergoing some testing. I'm just working on getting my blood drawn, and they're gonna do a huge blood metabolic workup to look at things that, most of us don't look at those things. I'm really excited. But she did diagnose me with acquired ADHD. So there is a difference. ADHD that you're sort of born with, which is what my daughter has, and my mom, except my mom might have had a head injury at the age of 2, but that's for a different podcast. Um, uh, but so yeah, I mean, to be prescribed, a stimulant, I'm not ready to go there yet, but I have it. It's just fascinating to me. Yeah, and I think that's it.
Yeah, there's so much that can happen after a concussion. ADHD is just one of the things. And sometimes we talk about symptoms that can look like ADHD and they might not necessarily be, but I think it's like 50-60% of people end up with ADHD after a concussion because of the changes in your chemistry and things from the damage that occurs from your traumatic brain injury.
Yeah.
So there's so many things that can go into it. And it's not. I remember when I first got into medicine, it was just a wait and see. You told people to rest until their symptoms got better, and then just time will tell, and everybody should get better. But now we know that that's not the case, and about a third of people will continue to have symptoms to some degree that continue forever. And it's all in how you learn to cope with it, learn to deal with it. Before we hit record, we talked about using humor a little bit. And
Hmm.
it's absolutely necessary because I joke about things all the time now. I use humor probably inappropriately sometimes and laugh about things that
Okay.
shouldn't be laughed about. But you
Yep.
know what? That there's just sometimes that you have to laugh to get through things.
Yes.
And it's the big thing about learning what you can do and learning how to use the skills that you have now. So I'm excited to see what happens with your whole workup with the Amen Clinic and see if
Yeah.
there's anything else that offer you to continue to improve at this point. You kind of mentioned that series of head injuries, and we know that cumulative effects make it so much more difficult to recover from concussions. So those head injuries in the past do play a role in how you're doing
Right.
now.
Right.
Being
Right.
a woman plays a role because women recover differently than men, and most of the research has been done on men. So,
Hmm.
we can't really look at that for either of us to see what our recovery is going to look like. So,
Yeah.
as
I
a
think I learned too that
yeah,
our necks that we're more susceptible to whiplash injuries because we don't have the same neck muscle structure to kind of
yep,
hold our head in place. And my dad put me on skis when I was 2 years old. Like I know I didn't stay standing.
Mhm. Mhm.
And and so just that, just being in high uh, I've been in numerous car accidents. I've been in, and then after my accident, I fell many times and know that I had whiplash injuries and have this incredible fear of falling at this point because I've fallen so many times, and it's just terrifying. And now that I know more about my brain, it's like, oh, I can do podcast interviews. I can just stay home, sit still, and I can still help people.
Yeah. Yep. And that's key is finding where you can still be the help and how you can do things just creatively. So
Yeah, yeah,
um, I'm
exactly.
glad that you are still working on things and
Yes.
working on getting better. So kudos to you for that one.
One second. Yep,
Yeah.
absolutely.
Where can people find you if they want to learn more about your clinic or your experience?
Yeah. In part of my recovery, I created a website called dearally.com. I've been told by many people pre-accident that I seem to be a wealth of wisdom and knowledge. For any of you who know social workers, we will go to the end of the earth to find you a phone number. If you tell us that you can't find something, like find a social worker, we will help you find it. Um, and so the wisdom that I had, I think my experiences that I've had with um, uh, difficult relationships, um, I'll go so far as to say, destructive relationships, uh, significant mental health challenges. So my story plus the wisdom that I've gained along the way, working on healing, creating pathways for myself to heal has helped a lot of people. And so as I was sitting on my couch recovering, feeling frustrated that I couldn't do what I once did, like I look back now and I think, you created a website? Like, who are you? Like, what? And so check it out. I haven't been on it for a while, but it's a place for people to ask hard questions. Um, it can be confidential. You can just, enter a question into the website. And I am very comfortable talking about just about anything. So nothing surprises me. Seen it all. I've worked in the sex trafficking industry, not as a sex trafficked person, but as a helper to those people. So I've worked in child protection. I've seen the worst of humanity. I've witnessed it. I've had patients who have been part of ritualistic abuse. Nothing can shock me. So if you have a question, if you are even doing something, this is so cool. Randomly, I got this Dear Ally email from somebody, and he told me that he was in one of the local hospitals and that he found my website and like he was like in a hospital bed and was I think getting ready to be admitted for some homicidal and suicidal thinking. And I ended up just texting with him all day. And he basically said, you just like altered the course of my life. And I'm like, well, that's why I'm here. People have these questions and I knew enough about how to make sure that I got in touch with the hospital if something was bad. And so I have the skill, I have the wherewithal that I'm not going to leave somebody hanging
Mhm.
who needs a higher level of care.
Mhm.
Like I don't think it's good for me to be treating patients, but for those sort of, help somebody in their time of need in that moment, I can do that. And if I can't, I have good enough boundaries to say, I'm not in a position, like on that day, if
Yes.
I wasn't in a position to help him, I would have said, I'm not in a position to help you, right? But I was able to that day. That day, I was having a good enough day. And I was just sitting on my couch. And so I was able to walk him through that. And that was incredible.
Mhm.
So, dearally.com, check it out, ask me a question. And then the website for my clinic is rivercounselingnmn.com. Um, I have other people that run it at this point, but that's where you would go if you're looking for trauma-informed care as a counselor, looking for a counselor, a mental health therapist. I don't really do, I kind of did Facebook for a while, but I don't think that's good for anybody. I'm already kind of depressed and anxious, and I don't I don't think Facebook's good for us. I don't know. That
Mhm.
scrolling thing, that
Mhm.
that can suck
Doom
you into
scrolling.
a vortex.
Yep.
Yeah. So I just recently deleted the app again. I've done it about 5 times in the last 4 years. We'll see how long that lasts. But dearally.com is the best way right now.
Perfect. Perfect. And as we wrap up today, are there any last words of wisdom you'd like to share with our listeners?
I don't know what my position is going to be in the concussion sort of revolution. Those of us women providers how our experience collectively is gonna, I don't know what my role is gonna be, but that I want to connect with the goal of helping that one person that I used to be, right? So when I was that one person listening and I got help from that, I know that I've been blessed by experiences that, although terrible, I've chosen to use them for good. And if my story can help others, I want to do that. So how where I'm going to fit in all of that, I don't know, but I kind of come to life with this, like, it's I used the word willingness earlier. It's kind of like I walk around going, yes, yeah, yes, as long as it's going to help somebody, yes, like,
Mhm.
I'm in, sign me up.
Mhm.
So for any of you who aren't there, and you just want to listen and take other people's experiences to let it help you, hallelujah. Like, that is so cool. And if I get to be one of the people that's out there, like, where if just one person in an audience of 1,000 hears something I said, and it brings them hope, that it's worth it.
Perfect. Perfect. Thank you so much for being here today, Ellie.
Yeah.
Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.